Lisa, we need to talk.
What about, doctor?
You failed to notice the contraindications on your last patient and gave him a massage anyways.
I'm sorry, sir, but what's so bad about me not noticing those?
Well, that last client had the herpes simplex virus and was clearly contagious.
So you're saying I'm infected?
Most likely, Lisa, yes. Now, don't you feel like it would be a good idea to learn about contraindications and diseases?
Boy, do I ever. Let's get started.
Let's start off with something simple. Do you know what a contraindication is?
Well, of course I know what a contraindication is. It is a presence of a disease or condition that makes it unsafe to treat a particular client in the usual manner.
That's right. And when a client has a contraindication, it is either a local contraindication or an absolute contraindication. Can you give me some examples of local contraindications, Lisa?
If a client was recently injured, an area is inflamed, or excessively tender when pressure is applied. Also, if a client has a lump, lesion, suspicious mole, or localized skin rash.
Right again. When a client has a local contraindication, it is okay to administer a massage providing that you avoid certain areas of the body. The other type is an absolute contraindication. Examples of these are a client with widespread infection or inflammation, a disease that is in exacerbation, a client who is in a state of medical emergency, a client with a fever, or contact with a reported disease that is highly contagious. Moving on. Considering the recent events, I think it is important for us to also talk about disease transmission and infection control.
You are probably right.
Disease transmission occurs when pathogens travel from a source to a host. Transmission can be by direct contact, vehicle or vector transmission, or inhalation of infected respiratory droplets. Now, Lisa, how do you think you contracted your disease today?
Probably direct contact.
Lucky guess. There are 3 types of direct contact: mother to fetus, animal to person, or in your case, person to person. Vector transmission occurs when infectious organisms are transmitted in or on a common vehicle or source. Vector transmission involves stings, or bites from insects, or animals that act as intermediaries of disease exchange between 2 or more hosts. Can you tell me what transmission via respiratory droplets is?
I think so. Wouldn't that be like when a person coughs or sneezes and the spit ends up being breathed in by someone else?
Well, that is a little blunt, but for the most part, you were right. Finally today, I would like to talk to you about infection control. There are many ways that you can unknowingly become infected during a massage with a contagious client. You may unknowingly touch an infectious rash in a treatment room with poor lighting and spread the infection to another part of the client's body. Infection can also be spread through contact with contaminated linens or other materials. In the 90s, the CDC published guidelines for healthcare providers called Standard Precautions. Standard precautions for massage therapists like us include hand hygiene, using disposable gloves, appropriately laundering contaminated linens, disinfecting massage materials and lubricants, and personal hygiene. In addition to these, there are a few easy ways to break the chain of infection. You can remove the infectious agent via hand hygiene, disinfecting contaminated areas, and so on. You can also create a barrier against disease entry using gloves. Always remember, the first line of defense against disease is your skin. So be sure to keep yours intact and practice proper glove use if you have a cut or open wound on your hands. Well, judging by how you're falling asleep, I guess that is a good point to stop for today. I hope you learned your lesson about properly dealing with infectious diseases.
Oh, I have. I'm sure this is a lesson that I won't soon forget.